Let's talk about instrument-assisted soft tissue mobilization. Is it covered by Medicare? Is it covered by other non-Medicare insurance policies? If you guys don't know me, my name is Tony Maritato. I'm a licensed physical therapist, and this is one of the questions that's really challenging to answer. I'm going to say you as the therapist need to develop your own internal policy to help you make the decision on how you answer this question. I would guess if you call Medicare directly and you ask, is instrument-assisted soft tissue mobilization a covered benefit? They're going to open up the Medicare benefit policy manual. They're going to flip to CMS chapter 15. They're going to look at other internal policies, and they're probably going to say no. They're going to say no because it's not myofascial release. It's not any of the definitions of manual therapy. When we look at, branding and corporate, I would say it kind of falls more in that world of like a branded term. But, it's instrument-assisted soft tissue mobilization. So we know soft tissue mobilization is a covered benefit. When we look at therapeutic exercise, it's like, is lat pull covered by Medicare? Well, it's therapeutic exercise when used by a therapist. It's using a machine to generate resistance to strengthen a muscle. So I think you could probably make a case both ways. I think this works to the advantage of both contracted therapists and non-contracted therapists. If I was a non-Medicare contracted therapist and I wanted to deliver instrument-assisted soft tissue mobilization as a cash pay service for wellness, for recovery, for stress relief, for any of those things, I think 100% I can do that. It is not a Medicare covered benefit in those cases. But if I was a therapist working in a outpatient orthopedic clinic and I was using that intervention to help reduce muscle guarding, to improve soft tissue mobility as part of my manual therapy, I wouldn't call it manual therapy, but I would call it an element of manual therapy. I do think that it would fall under the covered benefit policy guidelines. I think a big part of this is the intent behind it, the situation in which you're using it, back to like rock steady and boxing. So boxing as part of the treatment for a patient with Parkinson's could be an element of covered benefit, but Rocksteady itself does not qualify as a covered benefit. So you can use these things within your treatment, but these things themselves as a standalone is not a covered benefit under Medicare. I don't know if that gave you an answer. My main thing to you is I would say find the resources, read your MAC policies to make a determination on how you decide when it is covered and when it's not a covered benefit.